Today is going to be one of the last lessons I do in the first half of Chapter 5 before the first test in Chapter 5. We're going to cover homeostatic imbalance of joints since we just talked about joints, and then we're going to talk about some developmental things that happen within the body as we grow older. So starting with homeostatic imbalance of joints, few of us actually pay attention to our joints unless we're experiencing some kind of joint pain or inflammation. And usually when we see inflammation, we see a lot of swelling that happens in our knee. So one of the common things we might see is something called bursitis. This is called water in the knee, and it's basically inflammation of bursae, which remember, these are not part of synovial joints, but these are going to have a bunch of synovial fluid in them. If there is a bunch of inflammation, we're going to see pain in our shoulder, hips, elbows, and even in our knee. The other one is a sprain. This is a common term that most of you guys have heard of, and we define it in this textbook as when ligaments or tendons that are reinforcing the joint are damaged because they have either been stretched, twisted, torn away, and this can actually cause things to heal very slowly. You've probably heard of an ACL, and those usually result in a twisting or stretching of a joint. Another type that is very common that most people talk about is arthritis. And arthritis, I kind of describe as kind of a catch-all term because there are different types of arthritis. This term actually describes over 100 different inflammatory or degenerative diseases that damage joints. And degenerative means like it slowly breaks down over time. Symptoms are going to be pretty general. There's pain, stiffness in the joint, and even swelling of the joint. There are several different types that we'll talk about, but we're first going to talk about a few. Acute arthritis versus chronic arthritis. Acute arthritis results from a bacterial invasion, so bacteria gets into that synovial membrane, and it causes the synovial fluid inside of it to thicken. So it's no longer sliding, it's not slick. And then the other part is not only is that synovial fluid thicker, so it doesn't slide as well, the fluid production actually decreases. So where synovial fluid is supposed to decrease friction, these two things happening causes friction to actually increase, and you get that pain. The other one is chronic arthritis, and chronic arthritis is usually it happens throughout your life. You get diagnosed with it and you kind of live with it and figure out some remedial ways to help you. These include osteoarthritic, rheumatoid arthritis, and gouty arthritis. So we're going to talk about each one of those. Osteoarthritis is actually the most common form. It is chronic, so it's going to happen throughout your lifetime. It's degenerative, so usually throughout your lifetime it does slowly get worse. And it's going to affect the aged. So over 85% of people in the US eventually develop some type of osteoarthritis. And that's because over the years of use, cartilage starts to soften, it frays, it breaks down. You also see bone spurs that occur. And if you don't know what bone spurs is, it's just extra bone tissue. And it's common because of restricted movement. Or commonly resulting in restricted movement, so you don't have as much flexibility as you used to. This is very common in fingers, the cervical and lumbar joints of the spine. So I have a spelling error here. Now, cervical and lumbar, these are terms we cover when we go over the spine, but these are also terms we covered at the very beginning of the year. Cervical is going to be around your neck region, and then lumbar, this is your lower back of your spine. And then also this is going to affect your knees and your hips. You just don't have as better movement or flexibility. These are very rarely crippling, and most cases can be controlled by staying active and taking low-dose aspirin. The second one is rheumatoid arthritis. This is an autoimmune disease, and autoimmune basically means when the body attacks itself. So our body's immune system mistakenly actually attempts to destroy its own tissue. Nothing's wrong with the tissue, but your body thinks there is. And my dad actually has this. Onset usually occurs between ages 40 and 50, but it can actually occur at any age. The initial trigger is actually unknown, but they think genetics is involved or an infection. So if you get a bacteria or virus, even a fluctuation in hormones thought to be might be known as a trigger. It affects 3 times more women than men. So my aunt also had it. And the most likely place it's going to occur is your fingers, wrist, ankles, feet, and this happens in a symmetrical manner. So, what I mean by symmetrical is usually if it's on the left side, it'll also be on the right side in the same place. In my dad, the wrists are what really gets inflamed. Inflammation of synovial membranes, what happens here is those membranes thicken, the joints swell, and it's harder for you to bend because of it swelling so bad. And inflammatory cells enter that joint and release chemicals that cause the body tissues in that joint to slowly break down and destroy itself. The last one is gouty arthritis. This is a disease in which uric acid accumulates in the blood. This uric acid is actually deposited as needle-shaped crystals. So they're crystals that are hard and pointy in soft tissues of joints. So it's like getting stabbed by needles over and over again. And this typically affects single joints, and oftentimes you're going to see it in your great toe. This comes and goes. My dad has had this a few times and they've treated it and it's gone away, but it makes it very hard to walk. It's most common in men, and it rarely appears before the age of 30. It runs in families, so there is a genetic aspect to it, and typically drugs are prescribed to help with it, losing weight, and even changing your diet. Because this uric acid comes from some of the stuff in your diet. So they're going to tell you to avoid things like liver, kidneys, sardines, and even alcohol. That was the homeostatic imbalance of joints. If you have any questions, make sure that you ask. But we're also going to cover developmental aspects too, because they kind of go hand in hand. From birth to adulthood, a couple things that we've talked about, and this has been mentioned when we talked about how bones grow and develop. The first long bones in a fetus are going to be hyaline cartilage. And flat bones are typically going to be the fetal skull. These are made up of fibrous membranes. And as the fetus grows or as a baby grows in the womb, all that cartilage is converted into bone. And we learned about this when we learned about the development of bone. So here is typically a skeleton of a 12-week-old fetus, and the ossification process is indicated by darker areas. So you can see these darker areas is where a lot of that cartilage is being turned into bone. Now there are a few special things. The fetal skull has something called fontanelles. These are fibrous membranes and they helped connect the cranial bones, and cranium is just your skull. Now, their skull is not fused like an adult skull. They have something called soft spots because of these fontanelles are not straight bone yet, they're fibrous membranes. And the reason they have fontanelles is because it allows skull compression during birth. As a baby is being pushed out of the birth canal, their head has to kind of change shape in order to make it out. So oftentimes you might see a baby born and it has a cone head. And that's just the fontanelles compressing so that the child can make it out of the birth canal. The other reason that we have fontanelles is because it allows the brain to grow during late pregnancy and early infancy. So it allows brain growth. Typically, though, fontanelles go away and those bones fuse permanently, usually by the age of 2. So here are some fontanelles. So here is some bones in your skull, frontal bone. These are 2 parietal bones in your skull, and this is a occipital bone. And all of these will eventually fuse, but right now they have the ability to kind of slide and move. Over here, this is just the side view. Now, in terms of growth of your cranium, which is your skull after birth, it's going to be related to brain growth. If you increase the size of your brain, you need more room to expand. So you don't want a small skull. You want to grow bigger. Also, the increase in the size of your facial skeleton is also going to change from being a child to an adult. The reason for this is because you have tooth development and also your respiratory passages also enlarge. The last thing we're going to talk about is body proportions. So, how is the head in relation to the body? Well, at 2 years old, usually the skull is about 3/4 the size of an adult skull. So, it's not fully grown. About 8 or 9 years old, the skull is near the size of what an adult should be, and they start to proportion out a little bit more. So, you probably hear people having a baby face. And then between ages 6 and 11, the face will actually grow more out from the skull. Other skeletal changes is at birth, the head and the trunk are proportionally much longer than the lower limbs, but during puberty, females' pelvis broadens. And the reason they broaden is to allow for childbirth. That's usually when you hit your puberty and you are able to give birth. And the male skeleton usually becomes kind of a little bit more robust or filled out. By the end of adolescence, we did talk about this. Epiphyseal plates usually become solidified and they become epiphyseal lines when they ossify. So here is kind of the differences in the growth rate of the skull that we were talking about. So notice here that some of my fontanelles are going to fuse. So now we have the fusion of bones, they're stuck. Again, you also see here the face is more flat, but as you become an adult and you grow your teeth, you get more of a facial extension. It kind of comes out more. This picture here just shows the proportions of your body. So as you are an infant, a majority of your proportions does come from your torso. As you become 2 years old and as an adult, you become more proportionate. So your limbs actually get longer compared to your torso. And then last but not least, older adults, typically you're going to develop some form of osteoporosis, and this actually affects women more than men. Osteoporosis is a term you may have heard of. It's a bone thinning disease. It affects 50% of women over 65 and 20% of men over 70. This disease, the reason people worry about it is because it makes bones fragile. And so you can break them or fracture them a little bit easier if you just fall. Sometimes this is caused by poor diet or lack of vitamin D. Smoking can also affect it, or if you are not being active, so insufficient weight bearing exercise. This disease can cause not only fractures, but it can cause your vertebrae or your spine to collapse, and this results in something called kyphosis, also known as Dowager's hump. Dowager's hump. And I have a picture coming up here. This is the Dowager's hump that we're talking about because you kind of see you lean more forward. And then what actually helps with osteoporosis is taking extra estrogen. So it helps with the health and keep normal density of a female skeleton. So that's why when you get older and you're going through menopause, they do prescribe you some hormones to help with this. So here is your osteoporosis where you see bones, it starts to break down. And then, of course, this was your Dowager's hump. And that's the end of today's lesson. If you have any questions, just make sure that you ask, and I hope you guys have a great day.